So one of my friend who sent me to her doctor actually said, asked me to go to the Philippines with her. She was a client at the time. She'd been very successful with me and she wanted to continue, but she was being sent here for work. So I went over to the Philippines and my symptoms were getting worse and worse, and to the point where I couldn't really enjoy anything. I had some good days where I could get out, but for the most part, I got up to sleeping 22 hours a day. I'd be awake long enough to train her for an hour, and then awake long enough to maybe eat. And when I say eat, I couldn't eat anything. Eating was an extremely stressful situation. I could not be around anyone. I had to be calm because my breathing was, and I'd have to grab a table and go like this to lift up and pull some air in. So I pretty much got to the point of living on stewed prunes. I would soak prunes, I would eat sitting by myself. If I ate with my friend, she really understood and she was awesome. She knew not to ask if I was okay. And that's why I didn't eat with a lot of people, because naturally all day I did this. And so they'd get worried and they'd ask me, like, are you okay? But you know, when you're not feeling well and people say you're okay, sometimes it stresses you out more and then you just kind of get, and so she knew not to do that, but I'd usually eat on my own and I would just suck on these prunes that I already like boiled the life out of. Because I was starving, I was hungry, I really wasn't getting anything, but I couldn't breathe. So anyhow, it got to the point one day where she came home and she's like, this is ridiculous. And I had to sleep upright. I never slept down. I slept completely 90-degree angle, feet there, 6 pillows, straight up, because I couldn't lean back. Often I slept in my car when I was in Canada, not in the Philippines, because it was easier, it kept me upright. So anyhow, she took me into Emerge in the Philippines because I couldn't breathe, I couldn't eat. I wanted to rip my skin off. I was so itchy. I was freaking out. I was just becoming completely toxic. My stomach was distended, my skin was stretching and hurting. So in emergency, actually, a lot of people were thinking that yeah, so that's just showing some of the symptoms. Acceptance of death, that's one place that you would not be surprised to be in, but like I said, I was used to living and I was not living at all. So those are some of the symptoms that made me go into Emerge at that time. Is it that time? Oh, I'm like, wow, I'm really bad at this. So I went into Emerge, awesome. I went in there, they did an assessment on me right away. They called in a gastroenterologist, a cardiologist, they did x-rays, they did an ultrasound. I had so many doctors, it was amazing. They did a colonoscopy, they did an endoscopy. You can probably go to the next slide. My resting heart rate was 34 beats a minute when I went in, and my blood pressure was 84/43, so the anesthesiologist actually held my hand the entire time. There were about 6 to 8 people in there taking care of me. When I woke up, there were 6 people standing around my bed all staring at me, and they took me into her office, actually. You can go to the next slide. The head doctor, Dr. Flores, she sat me down and she said, I thought that was cute because they're amazing in the Philippines. She sat me down, she had a big chart like this beside her desk, and she talked to me for at least an hour, if not longer, and she said, okay, we found hemorrhoids here, we found lesions all throughout your intestinal tract, there's all kinds of bleeding in there, you have 3 stomach ulcers, you have a hiatal hernia, so my stomach, the sphincter that closes between your esophagus and your stomach had been blown open, and I had esophagitis, which was progressing towards Barrett's disease, which it would eventually lead to esophageal cancer. So that was explaining why I couldn't breathe. A lot of, so way back home in Canada, way back when my doctor was giving me Dulcolax suppositories, telling me to take X-Lax, this probably could have all been prevented, because what happened was, with the problem not being addressed, with the fact that I was not going to the bathroom, it was pushed to the side, like whatever. She literally left me in the office crying. She walked out. She gave me the prescription, put it down, and walked out while I was sitting there crying because she thought it wasn't a big deal. Whatever, eat more fiber, get this, take X-Lax to get it moving, and then carry on with your life. So I wasn't having movements, ended up with the hemorrhoids because I couldn't go to the bathroom, because I had hemorrhoids, tons of them, because I was trying to, because I wanted to, and then my whole stomach backed up. What happened was there's constantly food in my stomach, so my stomach's trying to break it down and get rid of it. Acid's constantly being produced, starts to burn holes in my stomach. The hiatal hernia, not sure, could have been a result of me playing rugby at the time. But anyways, that was open, and with that being open, all of that acid was also coming backwards up into my throat and just constantly burning away, and that's why I couldn't lay back and sleep, and that's why I was having the difficulty breathing all the time. So what I learned in the Philippines was that their approach is a little different. She said she exposed me to the difference between Eastern and Western medicine. She said over here that we focus a lot more on treating the symptoms, not the cause, not trying to figure out why you got there in the first place, but rather treating the headache, treating the pain, trying to get rid of it quick, rather than figuring out what's actually wrong. So she was the first person to introduce me to that whole concept, because until then I believed everything that doctors said. I followed it to a T, and somehow I was getting more and more sick. So thank you. So yeah, that's just showing the difference. She said symptoms versus cause, and trust me when I say this, I'm not slamming one or the other. I'm just saying that this was my journey. My brother had cancer, and I'll talk about that really briefly. I definitely understand Western medicine and its importance. When I had an emergency appendectomy a couple years ago, that was the one time, by the way, since 2007, I have had medication when they put me under for that, but I didn't even take the pills they sent me home with. I understand it serves a place. I think it's amazing what can be done. But we need to also start focusing on the cause, not just fixing things when they're really broken for the short term. Okay, so next one. Thanks. Okay, so this is what she sent me home with. She said we have to figure out what the cause is. You have to do that, but we also need to acknowledge that symptoms exist. So she gave me Nexium for the heartburn, for the reflux. Told me to take Maalox, Tums, and Gas-X for all of the gas that I was constantly having in my stomach, causing a lot of pain. Okay, my most important job is to take care of me. That's something I really learned in the Philippines, and I think that I hope everyone here could realize that we can't take care of other people if we can't take care of ourselves, and that was one of the greatest things that I learned. She taught me about the link between emotional, mental stress, and physical disease in the body, which I had not been exposed to up until that point. And so she explained to me how stress could have manifested into all of these conditions, or at least definitely be a significant component. So quickly about that, what I want to explain is that I had a lot of stress in my life. I mean, I saw a lot of health problems. My younger brother, didn't think that was going to bug me. My younger brother and best friend had cancer, and he was diagnosed, oh my, that's annoying. He was diagnosed when he was 19, and not long after, my older brother was in a coma. He was in an accident within a few months after that. He's here right now, so I should be smiling. Okay. My mom hit a horse. Okay, I rolled my car 4 times, went through the passenger window, off the windshield, ended up having shoulder surgery. As a result of that, I've got 3 screws in my shoulder. And yes, my mom hit a horse like 3 months after that, came through her windshield, crushed her. They needed the jaws of life to get her out. She's okay also. And my dad, he's had a lot of heart problems, triple bypass surgery, just a lot of different conditions with him. So there's been a lot of stress in the family, all in a really short amount of time. And at the time I was a student at Brock University. I was studying kinesiology full-time. I was playing rugby / coaching rugby at Brock. I was coaching A. Meyer in Niagara Falls, and I was working 40 to 52 hours a week, including midnights. And I had one brother in the Hamilton Hospital doing chemo treatments, and my other brother in London in his coma and then recovering from that. So what she explained to me is that I tried to be the rock. So I was always like, I've got this, no problem. I'm strong, I can coach you, I can play that position, I can be at this hospital, and then I'm gonna drive over to that one. And I just didn't sleep, and I didn't take care of me. I grabbed whatever I could, you know, on the go kind of thing, and I suppressed it all. I just let it, I thought, whatever, I'm positive, right? So I'm thinking everything's gonna be okay. And that did a lot of damage inside. So I just wanted to put that up there to say that emotional health is something that we all do need to consider. So if you're trying everything and you still don't feel well, you have to acknowledge your emotions and the state of your mind as well on your healing journey. Okay, so